record. Our meeting is now being recorded. So again, like I had said, thank you everybody for joining us and sharing in the chat your name, the entity of where you work from, and either professional or personal priorities. So we have Mason Ziegler. He is the Senior Associate of Government Affairs for the National Rural Health Association. Top 2 priorities, getting vaccinated. Good job. You got your first shot yesterday. Good job, Mason. And making sure rural is prioritized in the relief packages coming through Congress this year. Very, very important. Good job. And another 2 priorities shared, funding and dental providers for veterans in rural Arizona. And then initially, Marsha Brand, CareQuest Institute for Oral Health, formerly DentaQuest, from West Virginia. 2 priorities: encourage the Biden administration to be champions for oral health. Awesome. Support activities that promote oral health in Appalachia. This is wonderful. So glad, yes, like Joni is sharing. So glad you all are here. And so Joni, I don't know if you want to introduce yourself now, a little bit about who you are.
Sure. So I am Lisa's co-lead for the rural NRT, and we're really glad to have you all here. It's been a very fast year, I would say, for a lot of folks. We are hitting the ground running in lots of different areas for folks who are tackling COVID-19, who have prioritized things for rural, prioritizing things for their family and friends, and really trying to make things work differently in 2021. So I'm going to take a stab at this, Lisa. My 2 top priorities for 2021 are to keep people safe and healthy around me, and also taking care of my new son, Caleb, who was born surprisingly on Easter weekend. So we've had a fun little ride. So we are doing really great. But those are my 2 top priorities for 2021. And of course, spending lots of time with him on maternity leave that starts this weekend. So I think that we've had a couple of other folks typing in the chat. I see Tammy. I don't know if this was mentioned already, but school-based oral health programs and scaling those up. And then I think Annalise also mentioned some things about health equity in rural areas and supporting diverse providers and training for rural oral health clinicians. So keep that chat fired up, folks, about those 2 top priorities. It is kind of an icebreaker, but it also helps us to get to know what you guys are working on and how we can all contribute to some of those things that are your priorities, because we're kind of sharing this space to do that. Lisa, I'm gonna let you advance as people keep adding in their top 2 priorities. I'm hoping that your priorities as it relates to rural oral health actually kind of in some ways coincide with the goals and activities that we've been trying to work on as this vision that we have for this NRT group. And I'm gonna let you kind of look at this. This is kind of what we said we were gonna work on as our smorgasbord framework. We had 3 objectives, and we've had a good bit of activities that we've got to say, yeah, this group actually did some of those things. So Lisa, I'm gonna let you advance so that we can actually see what priorities we've actually been successful in. Oh, there you go.
Sorry.
So that's okay. So I just want to emphasize for this meeting, we are going to be talking about tracking through specific resources. Lisa and I will kind of do a quick little demo of a couple of resources that you guys probably already know about, but it's good to have repetition and refreshing. So that's why that red box is around our outreach plan. In order to do outreach, you need to have the right efficacious resources in order to reach out to people and share things with them. So we have a few of those we want to share today. The other 3 check boxes, you'll notice that some are in green, some are in red. Red checks are showing, hey, we've actually advanced in these areas, and green checks indicate we're still ongoing. So we've done a lot with sharing resources that we currently have just in our own organizations, and continuing to establish the network across grass tops and middles and aware of policy and other types of needs. Objective 2, we've been pretty hot to trot on our Take 20s. We've had a couple of Take 20s already, and roundtables, if you will, around rural oral health data. I think this group has been pretty strong with making some noise around that. So you see those check boxes there. And then as we are looking to the end of this year and even like a little bit into 2022, maybe, we have objective 3 with this idea around research and collaboration. So we have those kind of still working on those types of formalized ask and requests for some of those organizations, and specifically looking at maybe what the data rural data NRT is doing based on some things that we already have access to. So just kind of wanted to let you know where we are. And Lisa, I'll let you advance as we transition back to that red box. That's what we're talking about today, is our emphasis on some resources. Many of you have probably already explored or utilized the county health rankings website through Robert Wood Johnson Foundation. It has been updated and made to be so user friendly in many different ways. And so Lisa and I, this is a high level, just basic, hey, you guys, this is here, and you can utilize this to your needs. So Lisa, if you could click on the actual link there at the bottom left, countyhealthrankings.org for me. We literally just kind of wanted to like go through some of the things that I know Lisa and I have used and other states have used in order to get quick state facts reportings. And Lisa, if you clicked on that, we are unable to see. There we go. Oh, there it is. It's coming. Okay, look at that cute little girl. So Lisa has clicked on countyhealthrankings.org. What we are going to do is actually go to the mapping reporting section. Lisa, if it will take you there.
Reports.
Yeah. Or you can go to Explore Health Rankings. That's probably better. And over the Find County Health Rankings, if you could type in South Carolina. And click search. And then, yep. That top one, right there. So this is literally as easy as Lisa just made it. You literally type in your state, it will give you different rankings and measures. If you could click on, this is just an overview of the rankings for how healthy your state is. The darker gradients show you a higher number, and then you go down for lower numbers of what those health factors look like. Can you click on the tab that says rankings, Lisa? I'm sorry, measures, excuse me. And so it starts to get into more specific information here. I can look up quality of life. I can look up premature deaths. I can look at mortality. I can look at social and economic factors. I can look up down to the specifics of anything that I might be looking at. The reason why this is helpful is it helps paint the picture of what oral health looks and feels like specifically for your state. It also gives you lots of measures related to determinants of health. And you can download all of this. Lisa, if you go to that tab that actually says downloads, just so they can see like what it would look like, they actually give you a summary report for multiple different years. Can you click on 2021 South Carolina summary report, Lisa? Most of these are PDFs, some of them are Excel spreadsheets. Here is a very quick and very mouse size written document that has everything, all types of percentages and descriptives around what the overall aggregate is for the state of South Carolina. Lisa has highlighted the under clinical care. That's where most of the oral health measures are as it relates to ratio of population to dentist. There aren't super specific things related to a lot of gradients that we might be looking into for oral health, things like school-based oral health, things like oral health and long-term care facilities, but it does give you an overview of the availability and the access. So I just wanted to point this out. There's also a contact person listed for each state. And that's on that front page. So you can X out of this. This is just a summary report that you guys can always have access to for your state. If you go to the overview tab, I think it should be there. There it is. So the South Carolina contact, and this is obviously pulled up for every individual state. You can always directly contact those folks. It's normally at an Institute of Medicine or some sort of academic center or university. And so Lisa and I thought that that would be a good resource to remind everybody about if they've been there, and if not, to share this as a part of our talk today. And Lisa, you can go back and we'll go over the Am I Rural resource. Okay. Please feel free to type in any questions in the chat or stop me if we have questions as Lisa transitions back to the PowerPoint. I find that the County Health Rankings is a really good resource. Again, it's not drilling down into a whole ton of different specific metrics for oral health, but definitely a good lead-in for painting a picture. This is the Am I Rural tool. I even use this for a lot of my students at NUSC's College of Dental Medicine. It supports their understanding of the context of again, healthcare access, quality of care, and health professional shortage areas specifically. So Lisa, I am going to have you type in there my address. Can you type in 2041 Elvington? EL. Sorry.
Sorry. EL.
VINGTON Road. And let's see if it'll locate it. It should. I think this is the one we tested out. If not, sad.
No, sorry, no match.
Type in Johns Island, South Carolina. JOHNS. Yep. There we go. So run the report there, Lisa. All right. And scroll down. Okay, scroll back up, Lisa. I just wanted to make sure I did it right. A lot of times you guys like putting in the address, and Lisa, I didn't tell you the city or the state. So you'll have to put the whole thing in there. I tell students to actually put their full address in there to identify whether they're rural or not. I think it's a really good, useful tool because at the bottom, once Lisa finishes typing this in, you can actually see they will go through a gradient of levels of identifying the location, rural health programs, how they define your area. There it is. Thank you, Lisa. I should have told you that earlier. So it's sharing with me in my local area that my area is eligible for rural health clinic programs. That means that there are RHCs in my catchment area for me to receive healthcare access. If you keep scrolling up, that information is helpful because as a dental clinician or any other clinician, but as I speak to my dental students, I share with them that those are opportunities for you to do medical dental integration and provide referrals and such things like that. And in certain cases, there are dental sites in some of those RHCs. This goes through urban influence codes, medical underserved area descriptions at the top right there, that right there, all of those acronyms. So RUCA, rural urban commuting areas, rural urban continuum codes, urban influence codes, they give you the definition of all of those things. And it shares with you exactly how where you live maps up with that. Are you metropolitan? Are you non-metro? It tells you the population percentage of those who are rural, and it gives you a really good overview. Lisa, can you continue to scroll up? There's two last pieces that I wanted to kind of talk about here. Here is one of the hitter quitters, shortage designations. It tells me that for primary care, I technically live in a health professional shortage area. Dental care, it just says no. Mental health, Yes. Medical underserved populations, no, 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 no. And it'll keep going down and it'll tell you how it is describing where I live. A lot of times you can you can use the Am I Rural tool. You can also utilize there's other maps from Hersa that you can utilize to kind of map on to create a wider picture for yourself, and provide additional context. So again, this can be really key for things like grant applications or other collaborative um, workings that you might be collaborating with other people in the network. But it just really outlines the impacts of rural populations, specifically as it relates to some of these health professional shortage areas and other contextualized things. So the Am I Rural tool is really, really helpful. And there's other nicks and crannies on there that you guys can use, but this is just kind of the basics of what I have seen be really useful. And Lisa, you can go to the last and final source I think we were going to share today.
Yeah, and before I move on, I just want to mention what Annalise put in the chat.
Okay.
And I agree, it is a very comprehensive resource, particularly for rural health, and it also includes updated grant opportunities. Thank you, Annalise, for sharing that little tidbit, because I know my program specifically is funded by the Federal Office of Rural Health Policy, and so FORHP, so when we're looking at parishes, at least in Louisiana, to work in for our grant as deemed by Hersa, we are looking for that FORHP deemed yes, it's eligible. And so it's very important when you're looking at grant opportunities of different things that, particularly when you're looking at either statewide or county specific, what is deemed rural and looking at those designations. And as we are all talking about these resources, I'm going to go ahead and insert them in the chat. And, just again, to give that context, we are sharing these resources with y'all to help you guys be aware of what's out there and accessible for free resources that you guys can use in your work in compiling data and compiling information that speaks to the rural voice and that speaks to the need for different resources in the rural communities. And then Alexandria Holt also shared the oral health report that the Native Oral Health Network has put out is now on RHI Hub. Thank you, Alexandria, for sharing that. That is exciting. So that is a link that we will add to our minutes to advertise if anybody else wants to read. So that is great. And also, thank you, Zachary Bryan, for joining us from, he's the director of North Carolina Oral Health Collaborative. And thank you for sharing these priorities with us. So I did, and Annalise gave a little reminder in the chat for those that do that to add your pronouns to your display name if you're willing and able. And so great, thank you guys. And so I'm going to continue on and share our last resource that we're going to talk about today, called the Hersa Map Tool. And when I mentioned Hersa earlier, I'm referring to the Health Resources Service Administration. And like Joni and I had shared, part of our objectives is just sharing these resources with y'all to know what's out there. And so particularly, I'm going to look at shortage areas. So when we talk about health professional shortage areas, you can see that across the country and in specific areas. So by going to the Hersa Map Tool, which I'm going to go ahead and insert this link in the chat. So if anybody wants to search alongside, they can. Having a moment, I will insert it in the chat once I find my chat thing again. But either way, just knowing that you have this resource to help y'all in terms of searching for health professional shortage areas and what is deemed an area of need. So, and Joni had mentioned medically underserved areas and populations. And a lot of times grants specifically ask for serving and meeting this criteria. And so you can look at primary care HIPSAs, mental health HIPSAs. A lot of what the work I do looks at dental health HIPSAs and dental health areas and facilities. And so you can click that and essentially it creates its own map that you can display. I don't even know if I put a state, so I think it's gonna show across the country. I don't think I did any, meant to. so Joni put South Carolina, but I'm going to go ahead and put Louisiana to help highlight that and look at health professional shortage areas for our state specifically. So a lot of in my program, I always say we always serve the inside of the boot, and it's a lot of heavily dark shaded areas because we're serving the rural parishes, at least specifically for our program in Louisiana. But what's great about the Hersa Map Tool is, health professional shortage areas is just one thing that it can populate. You can add special initiatives, rural health areas, and you can just add that in and you can layer it, and it's just a great resource that adds more information with what you're looking for. And then what's great is you can export it and print it all just like you can with the previous resource that Joni shared initially. You can print it, export it, get those reports, get those maps, get what you're looking for in terms of what's happening in your state, and looking at awarded grants too. HRSA funds many grants across the country. And so when you're looking at specific programs, maybe you want to learn more about what's happening in your state, and just looking at the large list of options of what could be available to look into. Is your state funded, or what part of the state has that funding, and there's just so many options in there when you're looking at grant programming. And even initially too, looking at HRSA sites. So when you're looking at federally qualified health centers or health center grantees, there's just so many, the lookalike sites, there's just so many things when you're looking at delivery of care of what's specifically occurring in that area. It can really speak to that. So looking at lookalike sites, I just picked that arbitrarily, but it's populating those spots of health center program sites. So it's really great. And like Joni's sharing that when you're painting the picture of what is happening in your state or why there are certain resources that are needed, or, it just adds more to the story. And I think that's our overall push of sharing all these resources with y'all, is to know that there's more to it, and that when you look at the big picture, you can really explain of what's really happening. And so I'm going to go back to the PowerPoint we had here. So we went through the county health rankings, and we went through the My Rural tool, and we went through the HRSA Map resource, identifying variables, add labels to display your desired variables, and then export it. And so just continuing on, just sharing that, if anybody has anything else they want to share in the chat about those resources, that would be great. But otherwise, we just want to put that out there for y'all to know about. And then continuing on, so going on, that was heavily focusing on objective 1, now transitioning to objective 2. So a couple weeks ago, we did a Take 20. Chelsea Foss from ADA Health Policy Institute did a wonderful Take 20 on the impacts of COVID-19 on dental care, A Tale of Two Americas, comparing urban and rural, and the impact COVID has had in those communities. And the Take 20 recording can be accessed by clicking here. I'll go ahead and put the link in the chat. But just so you guys are aware that happened, that was something we were focusing on for specifically objective 2. But if anybody has any comments or thoughts that they had from that takeaway from the Take 20, feel free to share. Otherwise, I put the recording link in the chat so you can access that and watch it on your own time. But it was a great resource, just painting the picture of rural and urban with COVID. So it did happen a couple weeks ago, so I just want to share as a reminder. Okay, and continuing on, thank you to those that have already completed this Google form. This is something where for us, just to keep track of who we're sending calendar invites to and who we're, inviting to the meeting via email, just so we have a form database of like who our members are, which I will say at this point is 32, which is awesome. Thanks y'all for the continued growing membership. I feel like every week or every other week I get a response filled out. So that's really exciting. So go ahead and fill that out if you have not already, but if you already have and you already get the emails and calendar invites, you're already on it. You're good. But just so y'all know that that is continuing, and share it with others if anyone else is interested in it. And to continue on, we just want to highlight that our recording slides and minutes will be posted in our open communities page for our rural NRT. It's called Rural Oral Health. And so go ahead and check that out on open communities and see what we've had posted from previous meetings, and find a recording and slides from this meeting on there as well. It'll be probably up next week. So you guys have that. And that is a place for y'all to post resources and upcoming webinars and upcoming events. I know NRHA is we're going to actually advertise that in a little bit, but they're having a conference, and that's a spot where they've advertised that. So so here we are. Last week was the open, or 2 weeks ago, how the weeks collide, but the Sustainability Summit. So I'm not quite sure if the recordings and materials have been posted quite yet, but either way, that was an awesome experience, an awesome opportunity for those that were able to attend. And if anybody wants to speak to that and their experience, they can. Feel free to put that in the chat. But we did just want to put that out there, that did just happen. And if you missed it, that's okay, because those materials will be available following the meeting. Yes, I'm not quite sure if they have been posted yet, but either way, even though it just happened 2 weeks ago, I'm sure they're going to advertise when it is released. But we did just want to let y'all know about that summit that just occurred. Okay, yes, and this is what I had mentioned earlier. NRHA is having their annual and health equity conference May 4th through 7th. That is going to be virtually. We just want to keep that on y'all's radar. If any of you are interested in attending, I'm going to go ahead and put the link in the chat. And I don't know if Azil or Mason want to speak on it in any capacity, but that's an upcoming event.
I can take it away from here for just a minute. So NRHA will be hosting our annual and health equity conferences. It's going to be 3 jam-packed days of informational sessions. Yes, and that's the word I'm going to use, jam-packed. We have dozens of researchers and individuals who are coming in to share their experiences. There are also some scholarships that are still available out there for it as well. So if you're looking just to get more information on rural, or just try to get more in depth about what the equity space that we have going on out there, feel free to reach out to me or anyone on the NRHA staff who will be happy to help. Mason, you got anything you want to throw in there?
I think you covered it.
All right.
Great. Well, thank you guys so much. Okay.
Our rural shout out does include, thank you, Marcia, for mentioning the thing about the Appalachian meeting that's coming up. We have some details about that, Marcia, so we'll post that, and then as it comes along, please make sure that we don't forget that, Dr. Brand, in doing that. I know we have tons of information about the NRHA conference. I wanted to make sure that we're not missing any other rural shout outs of things that people have done that have been exemplar, and things that we should be mimicking, or any other things that we just need to recognize for anybody on this call.
So I was going to mention this. It's not a rural shout out. I'm so sorry. I was going to mention this whenever we were sharing opportunities.
No problem.
And we got slightly sidetracked. However, there is an upcoming workshop focused on policy and health equity that's being co-sponsored by several national organizations, including APHA and CareQuest and AIDPH, and Open, and probably like 7 other more at this point. And a piece of that will be talking about how to advance health equity as it relates to communities like the rural oral health community, and specifically policy advocacy pieces. So I just wanted to lift that up. I don't think registration is open just yet, but it should be open soon, and it'll come out through the open listserv. So just wanted to keep an eye out for that.
Perfect. Thank you so much, Annalise. We definitely will be looking out for that. Make sure we repost on our communities page so that we're well aware. Any other shout outs or updates from that we need to know about that folks should be aware about? All right, we'll keep it moving. So we are, again, Lisa and I are always coming up with these fun things to try. Our latest thing that Lisa and I are into is this whole flipped classroom thing. We both have done different versions of this, and we want to potentially try to do that for May. So we put together a fun kind of flipped classroom meeting session, and we'll send that out through calendar invite. We normally have these meetings on the third Thursday of every month, so that's what we're targeting for. Um, all the recording slides and everything, as Lisa has already eloquently mentioned, are going to be on Rural Oral Health Community. She does a little fancy thing where she sends it to you guys in an email too, because she's just thorough. So you'll get it that way too. I will let you advance, Lisa. Any other questions from folks before we give you 19 minutes back on the clock? And our emails and everything, as always, have stayed the same. Lisa and I are still gainfully employed at our institutions. So feel free to email us if you have any additional thoughts or questions. I know we had a couple of newer folks on today, and we want to just make sure that we continue engaging and connecting with all of you. And we hope that today's refresher or exposure to some of those resources will be useful for you moving forward. And we hope to use that as a part of our work group as well. And if there are no other comments or in hearts and minds are all clear, we'll close out for today.
Yeah, and I also just want to put a plug for Oral Health Communities. We keep mentioning it, but I didn't actually post it. But if those who are not part of our rural oral health community or open communities in general, that link is in the chat. So go ahead and sign up, free to sign up and really easy. And once you sign in, you get access to a bunch of more information, way more than you probably want to know outside of rural, but just in general, it has just so much information to share. So we just did want to put that link in there. So thanks, y'all. Hopefully we brought some joy to you this morning, at least for me. It's in the morning still, but thank y'all for joining us, and hope y'all have a great rest of your Thursday/Friday that we've all agreed it is. Okay. Okay, hope y'all have a great rest of your day.
Thanks, folks.